Coming on the second course, what if the ulcer is perforated? If the person is unlucky, if the virulence of the organism is very high, and if the immunity of the person is less, so it will perforate. All the 6 layers are involved. You can see out of the 6 layers, you can see if it will not directly perforate. If it is coming up to the fifth layer, what is fifth layer? Descent membrane. So let's start the ulcer from layer number 1. Okay, so ulcer is involving layer number 1. There is a breach. It is involving layer number 2. It is involving complete layer 3. It is involving layer number 4. That is Dua's membrane. And then it is involving layer number 5. So if it is involving up to 5 layer, the fifth layer is the descent membrane. If it is involving up to 5 layer, this ulcer is known as desmetocele. Desmetocele means about to rupture. It is impending rupture. Impending rupture. Okay, it is known as desmetocele. So अब वो सिर्फ एक layer पे टिका है, that is endothelium. Endothelium is still intact. So the ulcer which is involving the first 5 layers, the first 5 layer is already breached. But the sixth one is not breached. It is involving up to descent membrane, but not the endothelium. The endothelium is still intact. It is known as desmetocele. What is that ulcer known as? That ulcer is known as desmetocele. Learn this word, desmetocele. Now, even a small exertion by the patient, coughing, sneezing, straining for the stool, whenever we cough, whenever we sneeze, the pressure increase in our body, all the pressure, intrathoracic, intra-abdominal, blood pressure, intracranial, intraocular pressure. So it will rupture. It will perforate. Okay, and aqueous humor will escape out of the eye. Call aqueous humor. The IOT will fall. IOT will fall and iris lens diaphragm move forward. I will show you. So you can see this is desmetocele. First you see this is desmetocele. So you can see the 6 layers here. Appreciate the 6 layers. Try to see the 6th layer. This is layer number 1. Let me try to show you. This is layer number 1. We have 2, we have 3, 4, 5. So up to 5 layers it's destroyed. Okay, the sixth one is still intact. That is endothelium. So this is known as desmetocele. It's very thinned out. Even a small exertion, it will rupture. You can see this is desmetocele. You can appreciate this is the ulcer. Here in this diagram, this is the ulcer. It has already eroded the 5 layer. The sixth is still intact. You can see this is the ulcer. You can see it is about to rupture. It is known as impending rupture. So once the perfo occur, suppose here perfo occur, what's going to happen? See the next diagram. It's already perforated, the same area. It's already perforated. See this diagram and see this diagram. Here it's about to rupture. Here I'm saying it's about to rupture. Desmetocele is formed. But here it's already ruptured. Once it is already ruptured, the complete aqueous humor present here will leak out. The complete aqueous humor will leak out. Once the aqueous humor will leak out, the IOT will fall. Intraocular tension, intraocular pressure will fall. And this is known as lens, iris, diaphragm. This is lens, na? You can see this is lens and this is iris. This is iris. So we call it lens, iris, diaphragm. The lens, iris, diaphragm will move forward because aqueous humor is already escaped. So you have to understand all this. Okay, now if this perfo, not ulcer, it is no more ulcer, it is perforated. The ulcer is in front of iris. The iris will come out of this ulcer. Okay, so when the perfo is just opposite to the iris, the perfo is plugged by the iris. The perfo is plugged by the iris and healing takes place. It is known as adherent leukoma. Now it is known as adherent leukoma. Can you see here? So can you see in this diagram what you can appreciate? This is complete iris. Okay, the iris and this is ulcer. So the same iris is coming out of the ulcer also. You can see this is iris. The same iris is coming out of the ulcer also. You are getting my point. The same iris is coming out of the ulcer. It is known as adherent leukoma. So you know what is nebula, you know what is macula, you know what is leukema. Leukema will deepen. So first it is nebula. Nebula is involving first and second layer. Okay, macula is involving first, second, third ka less than 1/3. The leukoma is involving first, second, third ka more than 1/3. This one is involving all 6, 1 to 6. Okay, perforation already occurred. And that's why the iris is coming and plugging the perforation. Plugging. This is known as plugging of the perforation by iris. And it is known as adherent leukoma. So the perfo is plugged. The perfo is plugged. It is known as adherent leukoma. I hope you got it. The perfo is plugged. It is known as adherent leukoma. How many of you got it? Now you can compare. This is about to rupture. Compare the two diagrams. This is about to rupture. And here it is already ruptured. When it is about to rupture, it's known as desmetocele. Even a small exertion by the patient, it will perforate, it will rupture, impending perfo, and aqueous humor will leak. So if it is ruptured, the aqueous humor will leak, the lens, iris, diaphragm will move forward, iris will come and plug the perfo. Iris will come and plug the perfo. Now see this diagram and see this diagram. See this diagram. It is about to rupture. It has already ruptured. See here. You can appreciate in the clinical diagram also. This is all iris. And this is ulcer. This is the margin of the ulcer, the corneal ulcer. And the same iris is coming out. You can see it is plugging the ulcer, which is already perforated. How many of you got it?